Shoulder cars working in a chair, holding a tennis ball. This will help us to irradiate a little bit better. So I want you to breathe in and irradiate, starting off in external rotation. Find our roadblock, then we internally rotate. Continue to internally rotate, fight for it. Extending back now. Find our roadblock, externally rotate, continue to externally rotate as we come back around. So 1, 2, 3, 4, 5, last rep. Let's make it our best rep. Slow and controlled, searching for that space. Fantastic. Other side, breathing in and irradiate. One. 2, 3, 4, 5, and last one, our best rep, slow and controlled. Search for that space. What space do I have ownership over? Ask that question as you're working around. Make sure you're irradiating, working that best possible range. Coming down, and 6. Okay, shoulder flexion base, using a table, some yoga blocks. What we want to do is get you into shoulder flexion. We're going to place the elbow here. Fist up. I'm going to use this other block to keep myself in more external rotation. I'm going to come down, find my stretch in flexion, and then I'm going to use this block to kind of bring myself into the best possible range. Sometimes flexing your spine, posterior pelvic tilt, you can get a better stretch. So just find the line of tension, hold it there, and that's where we want to hold our stretch. Okay, shoulder flexion base that's set up. Use our block to get us into a little bit of external rotation. and just finding the line of tension. So sometimes that's creating a little bit of spinal flexion. We'll get you into that, but find the line of tension. And this is our stretch. Doing our breathing, let it go. Finding our stretch. Okay, a minute's gone. Just to go through our pales and rails. Our pales contraction is going to be pushing down into the block. Our elbow is going to be pushing down into the block. We're going to do this for 30 seconds. So build up the intensity according to where you're at with your rehab. If you're injured, you may need to build the intensity to about 5 to 30% intensity. Our rails contraction is going to make our elbow lighter off the block. Again, that's going to go for 30 seconds. Okay, counting you in 10 seconds. 5, 4, 3, 2, 1, pushing down into the block. This is for 30 seconds, so build up the intensity that you can feel comfortable holding for 30 seconds. Keep going, keep going. 10 seconds to go. 5, 4, 3, 2, 1. Opposite contraction. We're trying to lift our elbows off the blocks. Keep going, keep going. Ten seconds to go. 5, 4, 3, 2, 1, and relax. Recovery mode now for a minute. Good. We want to build up to our best possible contraction intensity possible to 100% when we're able to, but we need to have a really safe and best effort contraction. If you're injured, we want to back off that so that we can get re-education of the tissues, adaptation, and changes to the soft tissues deep to the joint capsule, ligament, and where that injury is. So 3, 2, 1, pushing down into the blocks. Keep going, keep going. This is 30 seconds, so hold the intensity that you can do for 30 seconds. Build it up. Ten seconds to go. Keep going, keep going. 5, 4, 3, 2, 1, and opposite contraction. We try and make our elbow lighter off the blocks. Ten seconds to go. 5, 4, 3, 2, 1, and relax, recovery mode again. We'll sit in this for about a minute again, and then we'll do our lift-offs. Great, our lift-offs help us to get that spatial awareness, giving our muscles some experience in that range that we've just opened up. Okay, 5, 4, 3, 2, 1. Slowly just coming out of this. And what we want to do is just get into a position where we can lift off. So I'm going to use a block where I can rest my head, getting a position where I can then lift off the block. So we're going to do 10, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We're going to hold it for 15 seconds. Keep holding. Keep holding. Keep going. 5, 4, 3, 2, 1. Okay, let's do our capsular cars. Kind of bring this one down here, resting your forehead. And now we're going to bring our arm up into this position, and we're going to rotate internally and externally. Slow and controlled, really focus on squeezing out that internal and external rotation. Making sure that you're not internally and externally rotating the forearm. You're getting that internal and external rotation through that shoulder. Slow and controlled, just squeezing that out. Let's give it another 3 reps. And last rep. Very good, coming out of that. Okay, left side, let's set up our base. We're going to put our timer on, 2 minutes. Okay, find our line of tension. Sometimes flexing the spine gets more tension in through that area. So whatever that is, you find that tension. And this is a 2-minute stretch. Good, I feel I can go a little bit lower now, so I'm just trying to get into that line of tension. Again, our pars contraction is going to be pushing our elbow into the blocks. Rails contraction is going to make our elbow lighter off the blocks. So I'll count you in. Okay. Gonna count you in. 5, 4, 3, 2, 1, and contract, pushing down into the blocks. 30 seconds contraction here, so build up the intensity to where you're at with your rehab. Best effort if this feels safe and controlled. Keep going, another 10 seconds. 5, 4, 3, 2, 1. Opposite contraction. We're trying to make our elbow lighter off the blocks. Keep going. Another 10 seconds to go. 5, 4, 3, 2, 1. That's recovery mode. Back into the stretch. Really try and search for that stretch. Remember to flex the spine a little bit. If you can do that to get into a greater stretch, find that line of tension. Great. 5, 4, 3, 2, 1. Pushing down into the blocks. Pause contraction. Build up the tensity to where you feel you can. 30-second contraction here. Great. 10 seconds to go. 5, 4, 3, 2, 1. Opposite contraction. Making our elbow lighter off the blocks. Keep going. 5, 4, 3, 2, 1, and recovery mode again. Find our line of tension, flex the spine, posterior pelvic tilt to get you into a better stretch. Great, 15 seconds to go, and then we're going to do our lift-offs. We want to give our muscles experience in the range that we've just opened up, get that spatial awareness and active control. Okay, just slowly coming out of this base, using a block to rest your head on. Find a space where you can actively lift your elbow up, and let's do 10 reps here. So lifting and hold. 2, 3, 4, 5, 6, 7, 8, 9, and 10. We're going to hold this for 15 seconds. holding it. Keep holding. 5, 4, 3, 2, 1, and slowly release. Now let's go into our capsular cars. We're going to extend our shoulder forward, resting our head on our block. We're going to lift up, and we want to do internal and external rotation. Slow and controlled here. Really squeezing out as much internal and external rotation of the shoulder, making sure that movement is only happening at the shoulder and not just your elbow. Let's do another 2 reps, slow and controlled. Great, coming out of that position. Okay, shoulder extension base. This is a difficult one sometimes to get into if we're injured, but we want to set up with our fist down and our shoulder in extension like this. I'll show you a different angle of it. So we're in that position and we're in extension. We're going to bring our elbow onto our knee so that we've got a really good support for our back when we're in the stretch. And we want to alter the intensity of that stretch by how far we're leaning forward and back. We do need to position ourselves differently depending on where we're at. Sometimes you may have to get a yoga block to prop yourself up a little bit higher to get into that extension base. Sometimes this needs to be higher as well, depending on where you're at. So for me, I'm getting a really good stretch just here, and I'm getting a really good extension stretch here. So find your stretch, and we start off with 2 minutes, a 2-minute stretch, passive stretch. And this is where we want to do our breathing, let everything go. Breathing in and out. Our exhalation needs to be twice as long as our inhalation to get into our sympathetic nervous system in that rest and digest state. And just relax, find the line of tension. Our pars contraction is going to be pushing our fist down into the block. Our rails contraction is going to try and make our fist lighter off the block. Our intensity, because we're injured, needs to be done according to where you're at with that injury and how you're feeling with that contraction, but we want a safe contraction. An injured joint, sometimes we want to start off at 5 to 30% intensity, but you need to be the coach with regards to where you're at with your intensity, but we want to slowly build up to best effort contractions over time. And that may take quite a few weeks to build up that. Great, so we've got another 20 seconds left and I'll count you in for our pars contraction. Five seconds. 3, 2, 1, contract, pushing your fist down into your block, contracting all the muscles of the shoulder. So we don't want to be contracting any other muscles or our back muscles here, just the shoulder muscles, building up to that intensity that we feel comfortable with our injury. Another 5 seconds to go. 3, 2, 1, opposite contraction. We're trying to lift or make our fist lighter off the block. This is going to be the hardest contraction to do. 15 seconds. Five seconds, keep going. 3, 2, 1, recovery mode. Find the line of tension and the new stretch. This is a 45-second recovery. And stretch. Ten seconds to go. I'll count you in for another piles and rails contraction. 3, 2, 1. Slowly build up, pushing down into the block with our fist, building up to a gentle intensity there that you feel comfortable with. 15 seconds to go. Five seconds. 3, 2, 1. And opposite contraction. We're lifting off the block, or trying to make our fist lighter, but we're not actually lifting off the block. It's an isometric contraction. 15 seconds to go. Five seconds. 3, 2, 1, and recovery mode into that stretch again. Find the line of tension. So we may need to alter the intensity and the duration of the piles and rails contraction according to where we're at. You need to be the coach for this one. Great, 3, 2, 1, and slowly coming out of that base. And so that's our shoulder extension base. Shoulder cars working in a chair, holding a tennis ball. This will help us to irradiate a little bit better. So I want you to breathe in and irradiate, starting off in external rotation. Find our roadblock, then we internally rotate. Continue to internally rotate, fight for it. Extending back now. Find our roadblock. Externally rotate. Continue to externally rotate as we come back around. So 1. 2. 3. 4. 5, last rep. Let's make it our best rep. Slow and controlled, searching for that space. Fantastic. Other side, breathing in and irradiate. One. Two. Three. Four. Five, and last one, our best rep, slow and controlled. Search for that space. What space do I have ownership over? Ask that question as you're working around. Make sure you're irradiating, working that best possible range. Coming down, and 6.